Our next presenter is from M3. M3 is our healthcare consultant. You may have heard that name in the past. And Virginia Van Haren is the Medicare lead. Virginia serves as the Medicare lead for M3 Elevate, where she works directly with individuals and employer groups to demystify Medicare and help clients choose the right plans that suit their needs. Drawing on more than 23 years of industry experience and a client-forward approach to every conversation, Virginia advises design, implementation, and management of Medicare program selections. She helps clients determine the essentials, providing tailored recommendations for Part C, Part D, and supplemental coverage that can offset out-of-pocket expenses. So with that, I'm going to turn it over to Virginia.
Hi, everybody. Thanks for coming. My voice is a little raw, so I apologize. So bear with me through this, but I promise I'm going to walk you through everything I can. I'm going to talk first a little bit about individual health insurance. I am the Medicare lead, but Natalie Damrow, who works in our Green Bay office, is our individual account executive. She's on medical leave, so I'm going to talk through her couple slides and hopefully be able to answer your questions. Individual health comes in many forms. COBRA is considered individual health. COBRA is actually a policy that you can get from your employer once you leave work. So if you leave your job, you have an option of COBRA, which generally lasts about 18 to 36 months, but you pay the full cost of the premium. So it's the same coverage you had from your employer, but you're now paying the full cost. Spousal coverage. So you're eligible for individual health insurance if you lose coverage from retirement. If your spouse leaves their job and you were on their plan, you may be eligible for an individual policy at that time. Medicare, when you become Medicare eligible, you would work with me directly or someone in my office. We have different locations available, and we would help you once you turn age 65 or in other cases of disability. Marketplace coverage, if you're not eligible for Medicare and you want to explore more options, we can help with that. So if I have a loss of coverage, right, from maybe my spouse's plan, if my child is turning 26 and needs to come off the policy, if I'm under age 65 and I do not have any other insurance available to me, you are then eligible for individual health insurance. There are many providers, flexibility depending on where you live in the individual market. I can tell you a lot of plans are still in the HMO world, and what I mean by that is basically you have to use their in-network physicians and providers. So when you consider different policies and different carriers that are available, it is based on where you live. Okay, so when you live in the Madison area, which is where I am from, you have basically 3 carriers available because it's based on where you live. If you live in the Wausau area, you may have 3 or 4 carriers available. We have minimal PPO providers, right? So we don't have a ton of nationwide carriers available. So when you think of like the United Healthcares or the Humanas or maybe the Anthem or Blue Cross Blue Shield, we don't have as many of those providers available. So what we would look at in those scenarios is to make sure your doctors and providers are within the network based on the plan that you pick. Okay, so those are the things that we consider when we're looking at individual health insurance. Most of the time it's guarantee issue if you have a loss of coverage, right? If I'm turning 26, I have guarantee issue to enroll into a policy. I do not have to wait till an open enrollment period. If I have a loss of coverage from my employer coverage, that would give me a guarantee issue to enroll into a marketplace policy. There are traditional copay plans still available. What I can tell you is a lot of carriers have rolled out HSA high deductible options. Those are still available in the marketplace, and you'll see that trending. You'll see a lot of plans that have a much higher out-of-pocket and deductible, and you can roll your HSA funds into these types of policies. So they are more in what we call the bronze area. So they base these policies like the metals, so gold, silver, and bronze. When you're on a bronze plan, you would have more out-of-pockets, but you would have a way to put in more funds based on the HSA. So these are very popular options that are available, and we would, of course, work with you to pick those options. Cost is based on your overall household income. So if I'm eligible for a marketplace plan, they would look at it based on my overall income. So the size of my family matters. If I have 3 people and my income is $60,000 versus 1 person and my income is $60,000, I'm going to get a better subsidy generally with 3 people because obviously I need to cover more. So when you consider that in an individual policy, we're going to be looking at all of those things and taking those into consideration for you. It's also based on your zip code, right? Like I said, if I'm in Madison, I have this available. If I'm in Wausau, I have this available. If I'm in Milwaukee, I have these carriers available. So you're not going to find carriers that are going to cover generally all of the state of Wisconsin. It used to be probably 10 years ago we had those options, but now it's more to the traditional HMOs where you have a network of providers that you'll need to use. Premium tax credits, this is one thing that has changed this year. So in 2021, we had the enhanced premium tax credit. This was basically based on COVID, and those were extended through 2025. They did, however, end this year, but it did increase the amount of subsidies. So we're hearing a lot of people have lost their subsidies based on those no longer being available, and they've gone back down to the pre-COVID amounts. So when we work with you, we're going to ask your income levels. We're going to ask you any information based on what you bring in. When you file your taxes, that is the number that they use to determine that amount that you would be eligible for. So all those things we would take into consideration for you. Now, President Trump's Working Families Tax Cuts legislation, expanded access to HSA. So I was kind of talking about that with the HSA plans. I can tell you there are a lot available. If you do have an HSA now, which I do believe you do, and you can roll any of those funds into an HSA in the individual market, or you can keep adding to those, they're great options, and you are getting much lower premiums. So that's what we're hearing, that's what we're seeing this year in the marketplace, is the HSA Health Savings Account marketplace plans growing. So you'll see a lot of those when you're looking for coverages, and we would walk through that with you independently to make sure we had those plans available and explain how they function and work. And this is Natalie's contact info. So she is available. This is her direct phone number and her email address. So she'll be back probably within the next month. So if you have questions, you can contact myself directly. You can reach out to HR here, and they can direct you to us as well. If you didn't keep the contact information, we'd be happy to work with you. So I'm going to talk a little bit about Medicare. I like to kind of go through this information. It's a lot. You guys have already sat through enough, I know, but I want to talk a little bit about Medicare because when you do retire, when you do become eligible for Medicare, there's a lot of information you're going to receive. I have people that come into my office and bring in loads of mail. I got 40 packages of mail. They bring in bags full of it because they want me to look through it because they aren't sure what's real and what's not. People will solicit you. All the carriers have your information. They're going to send you stuff to say, hey, sign up with me. And most of the time, people are unsure what to do. So what I can tell you is when you do become Medicare eligible, when you start considering what you're going to do, reach out to somebody. It doesn't have to be us directly. It can be ADRC, which is Aging Disability Resource Center. There are local people who work in the Medicare field, but look for an expert because they can walk you through the information, okay? So just be aware that it does start coming in the mail. You will start seeing that information, and most people generally are at a loss of what to do, right? We've all worked for a company for how many years? You know, your employer covers your insurance. You walk in, you get a job, they're like, here's your insurance, and we don't have to do anything for however many years we work. Once you come out of that and you go into the real world, you now have all of these options available, and you have all of these people trying to sell you a product. So what I will tell you is just take a deep breath, think about it, contact someone. You might know someone who's in this business, but you can reach out to us directly and we will walk you through it. But I'm going to start a little bit about the 4 basic parts of Medicare. Medicare Part A, which is your hospitalization, so think of that as your nursing and your room and board. Medicare Part B are your physician service or your medical insurance, as we would call it. Medicare Part C is a health insurance policy. It is called an Advantage plan. And Medicare Part D are prescription drug plans. So within these 4 policies, The only two that you get from the federal government, the only two that you get to sign up with the federal government is Medicare Part A and Part B. That is through the Social Security office. A Part C plan is a Medicare Advantage plan. These are sold by carriers, and prescription drug plans are also sold by carriers. So when you're signing up for any other policies, you would work directly with a carrier to sign up with that, or have an agent or broker help you in that process. So again, Medicare Part A, think of your hospitalization. It only incurs claims when you're hospitalized, right? I'm not hospitalized, I don't incur claims. But think of it as your room and board. When I'm in the hospital, my nursing, my room and board, my inpatient skilled nursing, my hospitalization for hospice care and home health services, these are all covered under Part A. The one thing I do want you to know, and I always put this up here on the screen based on the deductibles that Medicare has, is under Part A, if you did have a hospitalization, Medicare would cover all of your claims under that Part A except $1,736. That is the deductible for Part A. But that deductible can happen more than one time in a year. So a lot of people aren't aware that Medicare does not cover all of your costs. They do not. You will always have out-of-pockets with Medicare. Under Part A, it is $1,736, and that can be per episode, depending on the number of days in between a hospitalization. So if I go in March and I have a $10,000 bill, Medicare is going to cover all of that, but $1,736. If I go back in again in July and have another $10,000 bill, Medicare is going to cover all of that, but $1,736. So again, this is important to know because you will have out-of-pockets under Medicare, and that can be more than one deductible in a year. Now again, if you don't have a hospitalization, you don't have a deductible, but it's just important to understand that. Now there's no cost for Medicare Part A. Generally we all pay $0 as long as you and your spouse have worked 40 quarters of Medicare covered employment. 40 quarters is 10 years. So if I didn't work 10 years but my spouse did and we were married 10 years, I would get Medicare at a $0 premium. Your eligibility for Medicare Part A generally starts the first day of the month of your 65th birthday. So this is another important information to understand. If I turn 65 on June 15th, my Medicare eligibility is the 1st of June. So it's always the first of the month. It's not the middle of the month. It's always the first of the month. It can be earlier with disability, and when you sign up for disability, it's generally 24 months after you are accepted. Now, how do I enroll in Medicare Part A or Part B? Generally, if you are collecting Social Security, so you or your spouse might be collecting Social Security, then they will send you a card in the mail automatically. It usually comes 2 to 3 months prior to your 65th birthday, okay? So it's automatic. If you are not collecting Social Security, the easiest way to enroll is to go online to their website, www.socialsecurity.gov. You can sign up for Part A and or Part B, or you can call the local office and set up an appointment. Sometimes they'll do a phone appointment, sometimes virtual, or you could go in and meet with them. Now, Medicare Part B is what we call your medical insurance or your physician services. This is what we use most of. This is your clinic visits, your doctor visits, your emergency room, your urgent care visits. This is everything outside of a hospital stay. Well, this policy is a little different because in regards to how Medicare covers Part B is you have one deductible for the year that starts on January 1st and it ends on December 31st every year. And in 2026, that deductible is $283. After that deductible is met, Medicare pays 80% of your cost and you pay 20% for the rest of the year. A new deductible will start over on January 1st of every year. So Part A has a deductible per episode, depending on the number of days between. Part B has one deductible for the year, and then they pay 80% of the cost. Medicare Part B does have a cost, and this year, per month, it's $202.90. That is per month, per person. It is deducted out of your Social Security check if you're collecting Social Security. If you are not collecting Social Security, they are going to bill you every quarter. They'll send you an invoice in the mail. It'll say $202.90 times 3, and you have to pay that into them. Now, if you're a higher income earner, so if I make a certain amount of money per year that is my modified adjusted gross income on my tax return, they can charge you more money per month per person in premium, and that's called an IRMA charge, and that is decided by the government. So generally it's $109,000 if you file an individual tax return, and it is $218,000 filing a joint. Now, the reason that government knows this, right, is because the Social Security office is who signed you up for Part A and Part B. So they look at your taxes the past 2 years. So if I'm signing up in 2026 for Medicare Part B, they're going to look back at my income tax as of 2024. So if you are a higher income earner, you will want to talk with someone to verify what those costs might be for you, because they do go up substantially depending on the bracket that you're in, and that is per person if you are married. Eligibility for Part B is the first day of the month, again, same as Part A, that you turn 65, and earlier in special cases of disability. Now again, if I'm collecting Social Security, I'm going to be enrolled automatically. I'm going to get a card in the mail about 2 to 3 months. But since there is a cost for Part B, you do have the opportunity to turn it down. And one thing you're going to hear, if you turn it down, you're going to get a penalty. People call me every day going, my sister told me that I'm going to get a penalty, so whatever you said was wrong, and I need to enroll. Well, okay, well, what is your sister's situation and what is your situation? So it varies based on each person individually, okay? If I am an employee and my employer has 20 or more employees, Medicare is always secondary to my employer-sponsored plan. So if I'm a teacher at the school and I want to work past age 65, right? Maybe I want to work till 70 or 68, whatever that may be, I can absolutely turn my Part B down. I do not have to enroll into Part B, because as a secondary payer, the government says you are always able to continue to work as long as your employer has 20 or more employees. So you can turn down Part B. You do not have to take it as long as you are actively working and your employer has 20 or more employees. If your spouse is on the policy with you, it's the same for your spouse. So if my spouse turns 65 and I'm still working for M3 Insurance and I'm going to continue to work, they can also delay their Part B because they are on my policy. So it follows your employer, okay? So people get really worried about this 10% penalty, which you could incur if you weren't working or if your employer had 20 or more employees, because then Medicare is primary. What I can tell you is when you do sign up for Part B later, you will complete forms showing that you had coverage through your employer. This is what eliminates that penalty that you'll hear a lot about. You'll hear it from everybody. You're going to get a penalty, you got to do this, you got to do that. It's based on everybody's unique situation. So it's okay to ask the question. I always tell people, if you're unsure, call us. If you're unsure, give me a call and say, hey, Virginia, I'm turning 65 in 4 months, but I'm working, what should I do? There's nothing wrong with asking the question, and I would tell you, are you going to continue to work? Yep. Well, how much is your premium? Well, that's probably less than Medicare, so you can continue on your employer plan. But let's say your premium is a lot higher, right? Let's say I'm working and my premium is a lot higher than $202 even. It might be a conversation that we have, well, you can stay on the employer plan. However, it may make a little sense to look at some other policies to compare to what you have through the employer plan, because you can continue to work, you can enroll in Medicare A and B, and you can take a supplement advantage or a drug plan as well, even while you're working. If those rates would be cheaper, it might be an opportunity for you to take that on, depending, again, it's individual, it's all depending on you as what you're looking for coverage, if that makes any sense. Now, again, if you're not collecting Social Security, you will have to call or enroll online. Excuse me. Enrolling online is very simple once you get past setting up the My Social Security account. If you haven't done that, I would encourage you to. I've set mine up. It's a really nice way to look at your benefits as well, but that's where you go in and you apply for Part A and Part B. Again, employer coverage with Medicare, the rule is 20. 20 is the number the government looks at. It's based on the size of the employer. Medicare is secondary if your employer has 20 or more employees. 0 to 19, it is primary. You must enroll in Medicare when you turn 65, even if you continue to work and your employer has under 20 employees. And if you elect COBRA, that means you are no longer actively working, which means you need to have Medicare because it is primary. Now, Medicare and an HSA, I believe we have an HSA for our coverage available to us through our insurance through this employer, which means with Medicare and an HSA, if you want to continue to contribute to your HSA, and if your employer wants to contribute to your HSA, if they do, you cannot be enrolled in Medicare Part A and Part B. So if I'm turning 65 and I have an HSA, and let's say I'm turning 65 in July, and I'm going to continue to work for M3 Insurance, and I'm contributing to that HSA, and maybe M3 contributes to it a little bit, I would delay both Medicare A and Medicare B because I'm continuing to work. And yes, you can delay both Medicare Part A and Medicare Part B. Again, I have people call me all the time, no you can't, you must enroll in something, I need to go register, what do I need to do? You do nothing. You do nothing. There's no place to go out on Medicare to register. You don't go out and say, well, I'm going to work till I'm 70, so I'm going to register now for Part A. Nope. If you have an HSA, do not go out to socialsecurity.gov. Do not sign up for Medicare Part A or Part B if your employer has 20 or more employees. The reasoning for that is there is a tax law that the IRS put into play that if you have Part A or Part B of Medicare and you make contributions into an HSA, you could have tax penalties up to 20%. I'm not a financial advisor, but I can tell you that it can retro back, so you need to make sure when you're enrolling or contributing to an HSA, you're talking to someone once you become Medicare eligible, because there are tax penalties and liabilities, okay? So again, if I'm turning 65, I want to keep the HSA, which why wouldn't you? I would. I mean, why wouldn't I want to contribute? Maybe I can put a full family amount into that, and I want to delay Medicare. You do not have to do anything. There's nobody you have to call to tell them you're delaying. You just don't do anything. And when you want to sign up for Medicare, then you stop contributing to your HSA 6 months prior to retirement. So if I'm going to retire in January, I would stop my contributions in July. I would no longer contribute to that HSA. So that Medicare does not backdate your Part A 6 months, and then you would owe tax penalties. Again, if I'm going to work 20 or more employees, I have an HSA available to me, I'm going to delay signing up Part A and Part B if I want to stay on that HSA and I want to contribute to that account. Now, if you didn't want to contribute, you're perfectly fine staying on the plan. It's just you cannot make contributions. That's all it's about, is putting money into that HSA. Questions on that? Because I know that can be really confusing. Yes?
So if I am contributing to my HSA, my spouse now becomes eligible for Medicare, I can still contribute.
You can still, well, you could actually contribute for both of you. You could still do the family. So what happens is you are the owner of the HSA because you are the employee, so you own that HSA. If your spouse went on to Medicare Part A, let's say, because they were collecting Social Security, you could still do the family. It's just if you turned 65 because you were the owner, you wouldn't be able to contribute anymore. Yeah, so it's really about you being the owner of the HSA. And I always tell people, talk to your financial advisor. If you don't know, ask the question. You can ask us, we'll try to help you, but I am not a financial advisor. I always just tell people it's based on your specifics and when to stop contributing at retirement. I always consider that, but you would still be able to, yeah. This is what a Medicare card looks like, just so you know if you haven't seen it. It's beautiful, red, white, and blue, has your name, has a Medicare number. It will have your effective dates for Part A and Part B if you get it in the mail. And generally speaking, it will have the first of the month, never the third. But they literally put the third on here so someone doesn't cut it out and try to use it. Medicare Part D, which are prescription drug plans. So this is something else we would want to consider when you sign up for Medicare Part A and Part B. You will need a drug plan. Whether that drug plan is in your Advantage plan, in a health insurance policy, or it is a standalone policy, drug plans are for your prescription drugs that you pick up at a pharmacy, okay? It's always for drugs at a pharmacy situation. Your medications that you would get in a hospital, clinic, emergency room setting are all covered under your Part A and Part B of Medicare. So the drug plans are for prescriptions that you get at a pharmacy. There are numerous options available. Again, this used to be one of the most expensive parts of Medicare for a lot of people. This did change the last 2 years. There's no more donut hole. The maximum out of pocket you have in a drug plan is $2,100 for the year. But the one thing you will want to consider is making sure your medications are covered. If I buy a plan and I'm on Eliquis and my plan doesn't cover Eliquis, I pay for Eliquis. I pay for the full amount of Eliquis, okay? So you definitely will want to review these on an annual basis. You want to make sure your drugs and medications are covered. There are also particular pharmacies that different plans cover. In the state of Wisconsin, we have 10 plans only. Last year we had 18. We only have 10 available this year. But these plans, generally speaking, each have different pharmacies that cover. Most of them cover CVS, most of them cover Walgreens. Most of them will cover even Costco in general. But like if I'm at, Howard's Pharmacy, they may not be listed under that drug plan. So you really want to make sure your pharmacies are in network and all the medications you are taking are covered under these plans. Now, every year open enrollment happens from October 15th through December 7th. So this is when we are renewing all of our clients' policies, because all drug plans, all deductibles, all copays start over on January 1st. So when considering a drug plan, just know you can change it the following year, but it's very difficult to change mid-year. So even if you got added a medication that wasn't covered, you wouldn't likely be able to go to another plan in the middle of the year. Okay, so you will want to consider that. And you also do have to have a drug plan. It doesn't matter even if you have no medications. You would have to enroll into a drug plan, but we have 6 of the 10 drug plans in Wisconsin are at a $0 premium. So you don't pay anything for the premium, you just pay the copays for your medications. The other insurances that you can purchase is what we call a Medigap or a Medicare supplement or a Medicare Advantage plan. So when I get Part A and when I get Part B, I have really 2 options. I can do a Medicare supplement along with a standalone drug plan, or I can do what's called a Medicare Advantage Part C plan. And there are many carriers that offer many of these options, but these are really the 2 options that you get. And this is where educating yourself on the different policies is very important, because it's going to be dependent on what you need specifically. You may not need the same thing as your spouse needs, right? You might need different coverages. Most people have different drug plans. Most people have different Advantage plans. When it comes to supplement, a lot of times they'll do the same one, but you would want to consider that. So when we meet with our clients, we're looking at both of you individually. We're not looking at it as a group plan. There isn't a group policy available with Medicare. It's your own policy. You own it based on your Medicare number, and what you're looking at is going to be dependent on what your specific needs are. Health issues, pre-existing conditions come into play. You'll want to make sure based on your unique situation that you're getting the adequate coverage. So Medicare supplement our health insurance policies. Again, carriers have these. Humana has them, WPS has them, Physicians Mutual has them. There are a lot of carriers that offer these policies. They pick up the gaps in what original Medicare Part A and Part B do not cover. So remember that deductible under Part A, that $1,736 under Part A? Medicare pays as a primary. Whatever is left over, that $1,736, which is your responsibility, the supplement or Medigap plan would pick up. So Medicare pays first, then the balance to the supplement, and then the supplement picks up Part A. Under Part B, you have one deductible of $283, and then you pay 80% of the cost. That 20% that Medicare didn't cover goes to the supplement, and the supplement picks up the 20%. So a gap plan is really what it is. It's called a gap. It picks up the gaps that Part A and Part B doesn't cover. Now, generally speaking, with a Medicare supplemental plan, you can go to any physician in the country that accepts Medicare. When you're purchasing a supplemental plan, you'll be looking at the largest network available across the country if it says supplement. If it says select, like there are some plans that are carriers that offer like a select plan, like maybe it's Security Health Select, maybe it's Quartz Select in Madison. These are HMO networks, and they would require you to go to their physicians. But if it's a true Medicare supplement plan, you can now go wherever you want. I can go to Mayo if they accept Medicare. I can go to Freighter. I can go to Mount Sinai, Cleveland Clinics. I can pick and choose where I want to go to. So supplemental plans are for people who want to not worry about networks. I want to be able to go wherever I want to go to. So when you're considering those policies, they're higher in premiums, but you have less out-of-pocket costs because you really only have a 1 deductible with that. Medicare Part C Advantage plans, these are the second option that you get. Medicare Part C plans are plans, again, that are built by the carrier. Security Health Plan has one where you can actually purchase a policy from them. Quartz has one, Humana has one, United Healthcare has one. These policies combine your Part A, your Part B, and your drug plan, Part D, all into one policy. So generally, it's replacing Medicare Part A and Part B as they are not paying as primary any longer. However, you always have to be enrolled in Part A and Part B, and you still have to pay the Part B premium. But now the plan, let's just use Security Health for an example. Security Health's plan is now paying your premiums. So if I go in for an office visit, I would generally have a copay for that service. If I had an x-ray or lab work or emergency room visit, I would have a copay for that service. So now I'm contributing to the cost of my health care by paying for these specific services. Now, these premiums are generally lower. You can buy an Advantage plan for $0, but you will always have out-of-pocket expenses and generally a maximum out-of-pocket. But a lot of people really like these because you have one card, you have your own member number, your drug plan is in there. You would have to use specific network providers. Sometimes you can get an option with a larger network available, but most of these policies are going to have network providers. So I have to see these specific physicians, and I have to have copays for services that I have. Most of the time, the maximum out-of-pockets are going to range from $4,000 to $10,000, right? So this would be the max I would pay for the full year if something catastrophic happened to me. But a lot of people who are really healthy enjoy the Advantage plans because the Advantage plans, generally speaking, their usage is very minimal and they can save on premiums throughout the year. They will, however, have associated, obviously, when you think of your pharmacies in network, because it includes the drug plan, and your providers and hospitals have to be within that network. You always, though, will have urgent and emergent coverage and generally worldwide coverage. These plans are pretty nice depending on the network and the size of the network that's available. Like I said, a lot of people who generally are really healthy like these policies. Now, these policies do renew every year. So we have open enrollment from October 15th through December 7th, and new policies start over on January 1st. Whereas a supplement, it just keeps picking up, right, as a secondary payer. Advantage plans, deductibles, copays, out-of-pockets, they all start over on January 1st. So you can switch your policies in the Advantage world every year during October 15th through December 7th because they start January 1st. Now, these policies generally include preventative dental, eye exams, discounts on hearing aids, fitness programs, over-the-counter benefits, and meal programs. So whenever you see during open enrollment, which is in October, November, you'll see all these commercials with Joan London, you know, call 1-800 number, sign up, JJ is on there, you know, you'll see all these commercials. These are what they're talking about. These are the policies they're speaking of. You can get an all-in-one policy with everything included, and they have additional perks. So again, depending on what you're looking for coverage, I would always tell people consider pre-existing conditions because you may want to look at a supplement if you have a lot of usage or pre-existing. Advantage if you're pretty healthy or generally don't mind a smaller network. That might be a good route for you too. The one thing I will tell you is when you do go on an Advantage plan, in order to switch to a supplement at a later date, so say I'm on an Advantage plan for 3 years and then I go to the doctor and the doctor says, well, this is now happening, I would then have to answer medical questions and go through underwriting to switch to a supplement. So you can't just be on an Advantage and then go, oh, I was diagnosed with cancer, now I want to go to a supplement. They generally won't take you. So be aware of that when picking your choices. Understand and educate yourself on what you can and can't do during the open enrollment periods. When you're picking a product, make sure you understand the product that you're picking, because you may not be able to move later. You can generally buy down in coverage, and what I mean by that is if I'm on a supplemental policy, and I don't want to call it the best coverage, but what I mean in this scenario is generally with a supplement, you have a national network of providers, you have the best coverage when it comes to out-of-pockets, but you also have the highest premiums. So to switch from a supplement to an Advantage, you can do that during the open enrollment period, because they can call that buying down, even though it's not buying down. I mean, you're not getting lesser coverage, it just covers differently. But to go to a supplement later, you generally would have to go through their pre-existing questions. Okay, does that make sense? Couple of costs up there. So 202.90 doesn't matter, we all pay that, everyone's gonna pay that, so that's not really gonna matter in regards to the cost for the other plans, but an average Advantage plan in the state of Wisconsin is about $23. We have more $0 options than we've ever had. So just so you're aware of that, you can get a plan for nothing, you pay $0. Part B, 202.90 supplement, average $180, big difference, right? I'm going to go from $23 to $180 plus a drug plan, let's say at $34.50. So now we're looking at about $400 a month per person for a supplement when you put it all together and combine it. So when you're thinking about retirement, you can kind of use those numbers, right, based on what you might need and what those costs would be. And these costs generally go up every month, or every year, excuse me. Sorry. Now, the Advantage plans, though, we've seen drop to $0. So I think those are going to stay pretty steady for now. I think you'll see $0, you'll see $50 a month, depends on the premium. But the supplements go up every year, and it's based on your age. So I see increases happening. I see increases with Medicare happening and increases with supplementals happening. So consistently, you'll know on an annual basis what those numbers would look for you. But if you took about $400 per person per month if you went supplement, and I would say probably on 25 to 30 if you did Advantage, and the 202.90 with that, that would be an average number you could use if you're thinking in a few years. Okay, so just something to think about for retirement. These are just resources. SHIP, ADRC, I love them. I've worked with them for 23 years. They're in every county in the state of Wisconsin. They can't enroll you into a policy because they talk you through Medicare. They're great educators. It's free. Our services are free as well. Just so you know that, you can always call us and reach out to us. And then this is my contact information. Again, this is my direct line and my email address. If anybody has questions or wants to reach out to me, please do so. And just know that we will get back to you as soon as we can. And if it's just general questions, that's fair as well, because we want to make sure you have a clear understanding of the Medicare process. I know it's a lot. I know I went through it quickly. Any questions for me right now? I'd be happy to try to answer. Awesome. Thank you for putting up with my voice. I apologize, but I'm glad you all came.